Now, today on the channel, we are focusing on our frontline workers and especially healthcare workers as the country gears up for the arrival of the very first batch of the vaccines. Joining us now is Sicina, who is a nurse in Vosloorus. A very good afternoon to you, Rich. Thank you so much for joining us today. How has it been for you on the front lines? I mean, you work at a hospital in Vosloorus.
It's frustrating. It's frustrating to be honest, most especially in this time. Remember, healthcare system in South Africa was under stress and in ICU, to put it straight, even before the pandemic. As a result, we've been complaining before the pandemic. We've been complaining about gross shortage of staff. We've been complaining about gross shortage of material resources. We've been complaining about a lot of things. Here we run around trying to serve patients. Remember, the pandemic is not only affecting the community, but is affecting us as nurses as well. Our colleagues are sick and they go on quarantine and we are left to work days on end.
So let me ask you,
we are tired.
So let me ask you this, Rich. When your colleagues get sick and are somehow not able to come to work, are they replaced? Do you get substitute nurses who will come and lighten the load for you?
Never. And that is why we are always saying there's too much substandard mediocrity and that I don't care attitude, more especially from those in positions of authority. Out of more than 400 healthcare workers who have died, no one has been replaced. Those who have succumbed to the pandemic or to the virus and they have left us, they haven't been replaced. Even those who were employed under contract, it was just a drop in the ocean. So they are not replaced. When someone is sick, is at home, you need you who is healthy, who can still go and work. You need to stretch yourself. You need to stretch yourself to the limit and try to cover those who are not on duty. That is why we are tired, demotivated, and irritated.
It really sounds like a very frustrating situation that you are in, Rich. But let me ask you, how are you coping with the death of some of your colleagues? You mentioned there that you have lost some.
It's a matter of talking to yourself as an individual. It's a matter of us coming together as nurses, trying to motivate each other to say, let's keep on keeping on. But the problem is we are complaining and the situation is not changing. Even when we are trying to motivate ourselves, you still wake up the following day and go to a COVID-19 infested area that is grossly understaffed, that is grossly under-resourced. You are paid poverty-level salaries. Remember, we asked government to give us at least 6 months income tax break, not even permanent. We asked government to give us COVID-19 allowance, and they don't even want to implement Resolution 1 of 2018, and as far as our salary increase is concerned. As a result, even though we are trying to push, it's extremely difficult because those in positions of authority don't care about us, they don't appreciate, they undervalue, they underpay us. So we are just trying because we like what we do, we are passionate, we want to be of good service to humankind, we just want to help our community because we know if we can retreat ourselves as nurses, all the hell will break loose. It's just we are trying our best.
And how have you dealt, Rich, with the situation? You mentioned there that you're horribly understaffed, that at times you end up having to do the work of 10 other nurses, but those nurses are not there. What impact has this had on patients who at times need critical care and need it now?
If you know the story of Tembisa, I was saying this morning, Tembisa's story is a mirror of almost all public healthcare hospitals. In the midst of this gross shortage of staff, you watch patients die. Patients don't even get an opportunity to be resuscitated. They don't get a chance to be given another second to fight and yes, get another chance to live again. We are just helpless. It's a situation where you need to choose who to resuscitate, who to deliver. It's stressful, more especially seeing our people dying, and you know deep down you could have prevented those. It's because you do not have resources. Because sometimes we put patient on the floor. When are you going to see if the patient is on the floor? When are you going to see the patient is changing the condition? When are you going to resuscitate that particular patient? It's not fair.
Are you saying then, Rich, that if the authorities, if the health department had its ducks in a row, that there are people who have died that really would have survived?
Many, I'm telling you now, if we had enough staff, enough material resources, many people will have survived. Many.
Oh, we've just lost Rich's signal there. Very, very unfortunate that we've lost the signal at that particular time. And also so unfortunate the circumstances that Rich is accounting, saying that what we're seeing in Tembisa Hospital is really a mirror of what it is that's happening in so many of the hospitals around the country. I mean, you heard him there at the end saying that if our public health system was orderly, if there was enough staff there, many who have lost their lives would perhaps still have been here because their deaths were unnecessary. A really tragic account of what's happening in hospitals around the country. And Rich is working in a hospital in Vosloorus.